And for all of you wondering if you can get COVID-19 more than once, the answer is yes. It's possible to get reinfected with COVID-19 with the new and emerging variants of the virus. Doctors say as we move deeper into the summer months, it's important to get vaccinated and boosted to fight against COVID-19. Take a look.
The infection is still not a cakewalk, and it still has spin-off problems.
Doctors say although COVID-19 has become an afterthought for some people, it's still here, and the virus is infecting some people over and over again.
It's common to get reinfections with coronaviruses in general, and it looks like COVID-19 is just falling into line in that pattern. It's difficult to prevent reinfections, whether you've been vaccinated or had the actual infection.
In fact, health experts say a recent study shows those who have had COVID could face more challenges down the road.
There was a study that has been recently reported on, and it was out of St. Louis, and they looked at thousands of cases of people who had 0, 1, 2, 3, or even 4 coronavirus infections. And what they found is that each time you get a case of COVID, your body gets more likely to have complications like problems with your heart or with your lungs or your kidneys. Now, some of that may be due to the fact that the people getting multiple infections may have underlying problems already, but it does appear to be the case that the virus gets trickier and more evasive of your immune system.
And they say a new COVID-19 subvariant is becoming dominant across the country.
But this Omicron, there are a lot of different ones. You know, we had the BA1, the BA2, the BA212 one, and now the BA4 and BA5. And BA5 now is the majority of cases in the United States even. And it came on pretty rapidly. It is the most contagious virus yet. They just seem to get more and more contagious. And I can tell you, if you have your guard down, you're going to get BA5.
And doctors say one of the best ways to boost your immune system and help your body fight against infection is to get vaccinated and boosted.
So it's an ongoing battle. And we want to use all the tools that are available to us to help stop the transmission of the virus.
We'd like to have vaccines that will be a little more effective against preventing the infection altogether. It's hard to, with respiratory viruses, be absolute about that, but being up to date gives you the best chance of avoiding those other kind of, again, spin-off problems from COVID that we don't fully understand. You know, people were worried about the vaccine, the fact that it hadn't been out for very long and we didn't fully understand it. Well, you know, huge numbers of people worldwide and even in the U.S. now have it, and it's proven to be very, very safe.